Greg Stock. I'm the CEO of Thibodaux Regional Health System. I'd like to take just a few minutes and share with you some of the facts and figures and our experience here at Thibodaux Regional with the COVID pandemic. Before I do so, I want to assure you all that if you come here with heart problems, cancer problems, orthopedic problems, whatever it may be, that you'll find that we're still very focused on those things as well. Thibodaux Regional is a 5-star hospital, the only one in the state of Louisiana. 5-star is a top quality hospital by Medicare standards. Also, I'd like to express to the public how much I appreciate and we appreciate the efforts of our staff, our nurses, our respiratory therapists, our doctors, and others who are such an important part of that care process. How diligent they are, how well they work together as a team, and just a tremendous amount of effort that's required over now an extended period of time to provide that high quality of care. We can't say enough good about them. And we appreciate the patience of the general public, understanding that we're getting the job done, and we think pretty well. We're not shying away from that. We feel like we have a fairly agile organization that can adapt through whatever the difficulties are, whether it's a hurricane or this or other things. And we've built the organization that way, and it seems to function that way at a pretty high level, even though it's very challenging at times. At Thibodaux Regional, we had a high of 60+ patients around the first week in August. That was more than prior year. Today, there's 42 patients in the hospital who are diagnosed with COVID. There's 15 of those are in our critical care units, and 7 of them are on respirators. And so, there's younger generation much more involved than they were in the first go-around with COVID. The average age, I think, is 56 now, but it goes clear down into a few people are teenagers. So something to be taken very seriously. And with that, I'd like to talk for a moment or two about vaccines and testing. First of all, we've tested 40,000 people more, and we're testing 400 or 500 a week at least here at Thibodaux Regional. The testing involves coming here and we do the swab and so forth. And the turnaround really is pretty remarkable. It's just hours. So if you want to be tested here at Thibodaux Regional, we'd be happy to help you and accommodate your request. Now, if you want to be vaccinated, that can also be done. And vaccines are being administered weekly. We have, vaccines are done here at 12:30 to 4:30 on Thursdays and Fridays at our wellness center. And that process, for those that have been through it, if you've been near it, is pretty smooth. We've focused on the process itself, and it's really a pretty easy process. We've tested thousands of people at Thibodaux Regional, and just so you know, about 10% of them are positive. And it's hard to tell who's positive and who isn't until you're tested. And so it's a good thing to be tested. It's necessary in some venues and so forth to have been tested. About information regarding all this matter, where can you turn? And there's lots of it, and I think, unfortunately, some of it is sort of turned into disinformation. So we're trying to keep it simple, keep it straightforward, really try to understand the facts, the truth, which as much as we can know it, and follow that pathway. Recently, I invited Dr. Paul Monnier, who is an infectious disease expert, and Dr. David Patton, a pulmonary doctor, deals with respiratory illnesses. Both of those guys very well trained, smart guys, grounded guys that keep up in their profession, and have been with us, along with many of our other doctors, frankly, every step of the way from the onset of COVID last year. And so we shared, we brought forward some of the questions that we know are out there, and they addressed them. You might want to go see that video if you haven't seen it already. we want to do some more, and we will in the coming week or so as these things evolve and change. Thank you for all that you do for our community and our area. I just want to say that our purpose is to serve the people here. Thank you.